Home sweet home, the perfect place to recover comfortably. You'll be able to sleep in your own bed and be surrounded by everything that feels familiar to you. As you start getting back into your old routine, there might be a few issues that pop up along the way. Here's how to handle some of the more common concerns after surgery. Nobody likes pain. That's why it's the most common issue that patients raise before surgery. But the good news is that pain can be well controlled. To help you with that, there's a detailed discussion on pain management on the special features section of this DVD. Until then, here are a few key points to keep in mind.
Pain will probably be the worst in the first few days after surgery, gradually but noticeably getting better over the days and weeks that follow. How severe your pain is and how long it lasts will depend on a number of things, such as the type of surgery you've had. Controlling your pain in the first few days after surgery often requires prescription medications called opioids. Your surgeon will give you instructions for how to take these. Prescription pain medication can be made even more effective when taken with non-prescription pain relievers, like acetaminophen, or a non-steroidal anti-inflammatory medication, an NSAID like Advil. As your pain naturally subsides, you'll take your pain relievers less often or in lower doses, until you no longer need them to remain comfortable. However, these medications may not be appropriate for you if you have asthma, high blood pressure, kidney or liver problems. Pain relief that does not involve medication may also help. Relaxation techniques like meditation are safe. Physiotherapy and thermal therapy, where you apply cold compresses, may also be of benefit, but talk to your surgeon about it before you begin. Please do not apply heat to your wound, as this may increase swelling and pain.
If pain management is a patient's top concern, then worries about nausea and vomiting aren't far behind. Yes, nausea and vomiting are occasional outcomes of surgery, but usually only in a small percentage of patients. Your risk depends on different factors, including the type of surgery you've had, your level of anxiety and pain, and your reaction to the medications you receive. Tell your anesthesiologist if you've had trouble with nausea and vomiting after a previous operation. Often, there are effective techniques that can reduce your risk this time around. So what if you do everything you can and you still end up sick to your stomach? Don't suffer in silence. If you're in the hospital, tell your healthcare team, and they'll do everything they can to control your symptoms before you leave the hospital. If you're still feeling sick at home, here are some things you can do.
Avoid fatty foods and large meals on your first day after surgery. Drink plenty of clear fluids, enough that your urine is only lightly colored. Move slowly when changing from a recline to upright position. Consider taking an anti-nausea medication like Gravol if nausea strikes, and follow the directions on the product's packaging. If your pain medication is making your nausea worse, contact your surgeon's office.
If you have persistent vomiting and are unable to keep food, fluids, or medication down, go to your nearest emergency department.
Having surgery and being inactive during your recovery is a bad combination. Together, they raise your risk of developing harmful blood clots, also known as deep vein thrombosis, or DVT, that can travel through your system to your lungs, causing sudden shortness of breath, chest pain, and even loss of consciousness.
To minimize the chances of blood clots forming in your legs, get up and get moving. Move your legs frequently. While in bed, pump your ankles every hour to improve circulation. Squeeze your thigh muscles or buttocks. Hold for several seconds, then release. Simply getting out of bed and walking around is one of the best things you can do. Drinking plenty of fluids can also reduce your chances of forming harmful clots.
Notify your doctor if you develop pain, warmth, and redness in your leg, and go to the nearest emergency room if you have chest pain or shortness of breath.
Earlier in the DVD, you heard that certain medical conditions like heart or lung disease, Parkinson's, or diabetes can increase your risk of complications before surgery. And it's just as vital to keep controlling any pre-existing conditions after your operation as well.
Continue taking all of your usual prescription medications after surgery, unless told otherwise by your physician. See your family doctor or medical specialist if any of your medical conditions worsen.
A number of things can affect your breathing after surgery, including the anesthesia medications, inactivity, and pain. Following a few simple rules can help avoid serious lung complications such as pneumonia.
While recovering in bed, take 10 deep breaths every hour to keep your lungs fully expanded. Cough if you need to clear your chest of any congestion. And finally, get up and start moving as soon as you're able.
Isn't it funny how when you need sleep the most, it can be tough to come by? It's true. Sleep can be disturbed for days after surgery, but it will normalize over time. Medication, being in a hospital setting, pain, and anxiety are the usual causes, but they can all be managed.
Try to maintain a regular schedule of activity, rest, and sleep. Be as active as possible during the day. Take your medication as prescribed to control pain. Avoid caffeinated drinks after noon. Try to sleep in a cool, quiet, dark room. If you're unable to fall asleep, don't worry. Get up and do a quiet activity and go back to bed when you feel sleepy.
Although sleep medication may temporarily help reestablish sleep patterns, they can cause serious side effects by interacting with your pain medication and should only be used if approved by your physician.
Some people, especially the elderly, might feel foggy or confused after having surgery. In most cases, this condition goes away within days, but it can take up to a few months. Don't worry, it doesn't mean you're losing your marbles, as they say. You might just be reacting to pain, a different environment, medication, or something else. The good news, once again, is that you can play an active role in reducing your risk of post-operative confusion.
Let your medical team know if this has happened to you before. Elderly patients should receive a risk assessment before surgery. This will often be done in the pre-admission or optimization clinic. If you wear glasses or a hearing aid, bring them with you to the hospital. Avoid alcohol and eat a healthy diet before and after your operation. Make sure that any health problems you have are well controlled. And get into the best possible shape before your surgery. After your operation, ensure that your pain stays under control.
Constipation is a very common and uncomfortable side effect of taking certain pain medications and being less active. You can take a preventative approach by following these steps.
Drink plenty of fluids and eat a high-fiber diet including prunes or bran cereals. Consider taking a fiber supplement. If needed, a laxative like lactulose, glycinid, Senecot tablets, or Senna tea can be used for short periods. Your pharmacist can help choose the best product for you.
If you've had bowel surgery, follow your surgeon's advice regarding diet and prevention of constipation. And if you experience constipation with nausea and vomiting, consult your physician immediately.
It's possible to have difficulty urinating after surgery. This normally resolves itself, although it can sometimes lead to an overfilled bladder, which can cause pain and other problems. This condition is most common in men over 50, but can happen to anyone.
Contact your family doctor or go to the emergency department of your nearest hospital if you are having difficulty passing urine with increasing pain or pressure in your lower abdomen.
If you have a visible incision from your surgery, the skin may have been closed using sutures, staples, or special tape sometimes called steri-strips. If sutures were used to close the skin, these are probably the dissolving type. These don't need to be removed and will start to disappear within about 3 weeks. If staples were used to close your incision, a public health nurse or your physician will remove them. usually within 2 weeks of your surgery. Or your support person can be shown how to remove them. Don't worry, taking them out isn't painful. If steri strips were used, they will not have to be removed and will fall off on their own. If a drain was placed through your skin during surgery, it will usually be removed while you're in hospital. If you were sent home with the drain still in place, a home care nurse or your physician will eventually remove it.
Notify your family doctor or surgeon immediately if you find increased redness or painful swelling around your incision or drain site, or you notice a foul odor or yellow-green pus. If your temperature rises above 38 degrees Celsius or 101 degrees Fahrenheit, you should seek immediate medical attention.
Whether you're on the stairs or just walking around your house, remember that you might not be as steady on your feet as you usually are. Medication might affect you. You may not feel as strong or have your usual sense of balance. All reasons to take special precautions to avoid a fall.
At home, keep your floors free of clutter and objects. Make sure that halls and stairs are well lit at night. If they are available, use the handrails on your stairs. Always get up slowly after sitting or lying down, and take time to get your balance before taking a step. In some cases, if you've had surgery on your legs or you are elderly, a walking aid like a crutch or a cane may be necessary until you are more stable.
Well, we've reached the end of our main video. We hope you found the information helpful, and because there's so much information to take in, we encourage you to review this DVD as often as you need to before and after your surgery. If you still have more questions, check out the special features section of this DVD and stay in contact with your healthcare team. They're here to guide you through this whole journey and to help you take charge of your own health. Thanks again for watching and for choosing to be an active player in your care and your recovery. Good luck with your surgery and happy healing.